Maybe patients are now more educated. Patients are more intellectual. Patients go to the internet. I mean, that 2 decades ago, we don't have the amount of knowledge that a patient can gather from from the internet. So many a time we will see a patient coming in. You see, because I do administration. I also am a clinician. So patients come in and they're all equipped with their knowledge, whether it is a well-researched knowledge, medical knowledge, or it's just some hearsay knowledge. You can understand now we have blogs. I had experience in talking to a pregnant woman who has gone through a lot of blogs, and all the information on the blogs are written by other pregnant women. So other pregnant women probably have their own customs in different countries. So the blogs are not local; it's quite international. So we have to really explain to these patients regarding their stress, their fear, their lack of knowledge, or their too much knowledge. Okay, so it's different. We see a different generation of people. So it's not. People suffer from similar illness, but they are different people. When we look at our children already, we know they're just a different generation. They're more demanding, especially in Hong Kong. Hong Kong has moved up in the level of, let's say, called sophistication. People have been traveling. I mean, when I was young, I didn't actually leave Hong Kong until I was in university. So now people start traveling when they are 2, okay, or even before they walk. And they are exposed to a lot of different cultures, and people are more demanding. You can see even in restaurants, in the streets. So when they come into a hospital, they're more demanding, and they sometimes are right in demanding what they deserve. I teach medical students. I say the big difference in private, when we look at patient care, is we manage a patient, an individual. When we're in medical school, we are taught illnesses, disease. So you look at a disease and you have to try and understand the disease, like what is the cause of the disease and how to diagnose the disease, and you manage the disease. So you're very disease orientated. And when you look at patient care, you are patient orientated. 2 patients suffering from the same illness, they look at the disease completely differently, and their wish of the sort of managed pathway may be differently. You can understand some patients when you talk about operations, they really have a fear of the knife. Some patient will say, no, please cut it out. So it's completely different. So we have to understand the patient. It's not just disease care. It's really have to remember that this is patient care. And so we have a big medical part that we need to look at. Okay, we manage a patient with a disease. So when the patient is in a hospital, then we have to manage the patient's sort of like environment. It's coming into the hospital that is a very strange, unfamiliar environment. So we have to make them comfortable. It's like a hotel business. So it's a combination of a hospital business with a hotel business. It's like when we go traveling, we walk into a hotel in a strange city. So we have to look at in that perspective in order to think what we should do to improve our patients' experience in the hospital. So it's like in Hong Kong Sanatorium, we did actually ask a hotel to come to train our staff on the service part. So we have a health care part and a service part to combine that two to provide better patient care in this hospital. So you look at the website and we have a motto. The motto is excellence in care and quality in service. So we actually look at care and also in service. I mean, this is a private hospital. Of course, patients come to hospital for medical care, to recover from an illness. It's for their health. But we also would like to, at the same time, to provide a quality in service. So we emphasize in total patient experience when they come into the hospital. So it's not just, hopefully it's not just the medical side. I mean, that's important. That is dealt with by the doctor and by the nurses who assist the doctors in the role back to health while they're in the hospital. But we also would provide an experience for the patient so that they don't feel too how you say? When you're ill already, you are quite stressful. We hope that the patient would have a better experience in the hospital. That's why we run training for nurses, and we have forums in the hospital to discuss this. We have retreat every year with senior staff of the hospital to discuss how to improve a patient's experience in the hospital. We are striving to improve patients here. I mean, as you mentioned earlier, or you asked earlier, how is patient care now and 2 decades ago? Obviously, we are seeing different generations of patients. Obviously, we're seeing different patients in the next 10 years. There's technology. 20 years ago, we wouldn't have the technology we have today. So, but then we do not just rely on technology. Then we have our own staff coming into the work in the hospital. So there are different groups of people we need to manage. They are all changing, and we have to integrate all these together to improve. I think it basically we have to go through the same cycle again and again and again and again to improve patient care. We have to ask our client what they want. All right. We have been doing patient satisfaction survey, and we have to continue to do patient satisfaction survey. We'll probably have to look at sort of maybe different criteria, different questions to ask when we come to a different generation of people. So we do the same thing, but with some adjustment. So we do patient survey and continue to do that. We do training, the second part. So we train our staff. So as the time changes, the training program may change. All right. And to satisfy different need of different patients. So the group of the patient would be changing. The characters would be changing. The demand would be different. Okay. So we have to understand them first, and then take the result back and train our nurses, our staff, and we'll continue to improve by holding discussions among the sort of high executive. As I point out, we will continue to have our annual retreat. We'll probably have to do more. In the last retreat, we will say, okay, we have annual retreat. Is that enough? We may have sort of mini sort of meetings throughout the year to use this information, like the survey, the satisfaction survey, like the training that we organize, and we review them instead of reviewing every year. But the retreat is good not only just for improving patient care, so get all the people together, so staff like that, retreat, boost up our spirit. We know what we want, we know our core value, and continue to improve our total patient experience in the hospital.